Good evening, everyone.
Hey, what's going on?
Good evening. Good evening.
Okay, so I need a little more energy in the room tonight. Good evening.
What's going on, President Clee?
Good
What's going
evening.
on, man?
What's going on?
Good evening.
Yeah.
That's much better, much better. Thank you all for joining us this evening. So we've been hosting these live streams entitled COVID Uncovered. And we decided to do this because we wanted to ensure that information that we just flooded our community with a mass amount of information, especially when it comes to COVID and with the execution of the vaccines. And we just want to ensure that our community has access to reliable, science-based, evidence-based information so they can make an informed decision. So I wanna put a disclaimer out there. We are not endorsing, but again, we just want to make sure everyone has the correct information so they can make an informed decision whether or not they want to receive one of three vaccines: the Pfizer, the Moderna, and now the Johnson and Johnson that was just released, I believe, this week. And as you all know, the Johnson and Johnson is one shot, and then the Pfizer and the Moderna is two shots. And so there's been a lot of conversation in community about the hesitancy, specifically when it comes to Black and Brown communities, and our hesitancy in getting vaccination, or I should say vaccinated. Um, Allegedly there's a lot of hesitancy, but I was in Ben Harbor at a vaccine clinic earlier this week, and you know, having a conversation about that, and the focus to get the Black and Brown community out and make sure they had an opportunity when presented vaccinated. And one of the things I've been taking my own qualitative, I'll say, research is that I think it's this. You have had a number of on these live streams. So one of the things that I hear from our youth and youth saying, how are they feeling? And so I just want to have a conversation with all of you tonight about your concerns, what you are hearing actually, and just kind of let's just flow from there. It's not necessarily a formal thing. This is not scripted. I actually intentionally didn't have any questions because I want the conversation to be authentic, and I wanted to really want to hear and want our viewers to hear your voice. And so what I would like to do is go around and do a quick introduction if we could. And I want to start with ladies first. So Nomi, if you can start, and then we'll flow from there.
Hi, everyone. So my name is Nomi Chaudhary. I am currently a third-year medical student at Michigan State University. And then in terms of the vaccine, I just want to put out there that I have already received both doses of the Moderna vaccine, so I can speak about my experiences in regards to that.
All right. Thank you, Nomi. Mr. Carl.
Good evening, everyone. My name is Carl. I'm a sales manager for a retail furniture store, Bob's Discount Furniture. I have not received any part of the vaccines, and obviously it's something that's a concern for me because I see so many people every day I go to work. So that's going to be kind of where I would like to come from tonight.
All right, thank you, Carl. Mr. President Javon Fields. He might have bumped off, lost connection. So we'll move to, okay, Javon.
Can you all hear me?
We can hear you loud and clear.
Wi-Fi issues. But good evening. My name is Javon Fields. I serve as the president of the Greater Grand Rapids NAACP Youth Council. I have not taken the vaccine yet, and I'm still questioning if I will take it. Was that all we get to do, President Jackson?
Yes, just introduce yourself right now.
Yep. So,
and then unless you have anything else you want to say.
That's pretty much it. Just looking forward to this conversation about COVID-19, the impact of COVID-19 on our lives and the vaccine.
Okay, thank you, sir. Colin. Come on now, represent Alpha Phi Alpha in the right way. See, you all outfitted in that. It looks like that alpha paraphernalia, that tie. I see. We see you.
All right. So my name is Colin Lewis. I am a current fourth-year senior biomedical science major at Grand Valley State University. Some of the things that I'm kind of aware of right now in COVID, I've not been vaccinated myself, but I do hear a lot of controversy around campus and the community. And so I kind of speak on that, get my take into what I view it as a science major and the value that it has in the community and the impact. So.
Okay. Have your Alpha brothers work on that volume while we're finishing up the introductions. And our last guest, go ahead, brother, introduce yourself.
What's going on, everybody? My name is Onesimus Peewee. I serve as staff at the NAACP, and I'm also a entrepreneur based in Grand Rapids here. And as far as the COVID vaccine, I have not taken any doses of that.
All right, I'm in my bad. Our last guest, our brother, go ahead and introduce yourself.
Hey y'all, my name is Dino Fanfan. I'm a medical student actually in South Florida. I'm not anywhere near any of y'all, but it's nice to be here. And in terms of COVID, I've been vaccinated actually already. I've only had my first dose of Moderna just yet. And sort of my past, I've been working in healthcare and improving healthcare literacy in low-income communities for a long time. So I'm very excited about tonight's conversation.
All right, so let's just jump on into this. And so I want to ask Nomi, since she's a medical student, and essentially, at some point, because I'm sure you're doing some clinical stuff, and so probably are considered a frontline worker on some level, right? Want to get your take in terms of what was the experience like in terms of taking the vaccine. You've had your first shot and your second shot. Did you have any complications? And as well, what are you hearing from your peers?
So most of my peers, along with me, received the Moderna vaccine. A few of them have received the Pfizer vaccine. So after my first dose, I didn't experience too many side effects. In terms of the side effects, a lot of the common side effects that people do speak of when they receive the vaccine are fever, chills, fatigue, so just being tired, kind of having like a loss of energy, but say that those side effects should disappear within 24 to 48 hours. So after my first vaccine, I felt slightly feverish, and that went away after 24 hours. And most of my colleagues who received the Moderna vaccine felt similarly. There were a handful that didn't feel any side effects. And then most of my colleagues who received the Pfizer vaccine didn't have any side effects either. So after the second dose, that's when I felt more of the side effects that people talk about. So I felt more feverish. I felt really tired. And I had a shift in the hospital that day. So I was just exhausted. Um, and so I did take over the counter Tylenol regularly for about 24 hours. And the symptoms or the side effects kind of hit me 3 hours after the vaccine, but they went away. And it's been about 3 months since I've had my second dose, and I haven't felt any other side effects or anything like that. Most of my colleagues who received the second dose of the Moderna vaccine felt similar side effects,
Mm.
but my colleagues who received the Pfizer vaccine didn't have any side effects after the second dose. Um, so that's what I can kind of talk about. And then I think there was someone else who mentioned they were a medical student. I think it was Dino, and I know he received the first vaccine, so maybe he can talk about some of his experience as well.
Yeah, thank you, Nomi. Also, yeah, Dino, if you can talk about your experience with receiving the vaccine, and I also want to, what medical school are you attending?
So I'm at the Florida National University's College of Medicine, Herbert Wharton, here in South Florida, and so I got my first dose about a week and a half ago, and the only symptom I actually felt was just soreness in the right arm. Most of my colleagues as well, they just felt general soreness. Some did report having a fever and maybe chills, but in general, everybody felt pretty well. I guess one additional point I would add is I also work very closely with our local cancer center here, and my mom's actually a patient there, and she received both her doses. And in terms of symptoms, like the very first shot, she had Pfizer, and it went really well. She only had a mild soreness for about a day and a half. And her second shot, probably the day after, she had a fever. She was just sort of like in bed for a day or a day and a half, and she was just fine after that. Now she's sort of going grocery shopping, which she hasn't really done in 7 months. But overall, we're doing pretty well so far.
So and Nomi, this is for you and Dino in terms of medical students. I just want to applaud you for taking that leap, because one of the things that we realized, and actually because I've worked in all transparency in the healthcare industry for my entire career, and have been with a national healthcare organization for the past 25 years, coming up on 26 years. And, you know, one of the things I think that has lifted up for many people is the glaring disparities that exist in the healthcare field. And so I just want to take my hats off to both of you for signing up to do this critical work and necessary work. The question that I have, as you are going through your medical school experience, is there much talk or training with respect to healthcare or I should say disparities, and also the class standards? And either of you could take that.
So at our school, it's actually integrated in the curriculum to consider healthcare disparities as part of the course of health. So my school specifically is very much focused on having the students work directly in the community. So personally, like I live in Miami, and most of like the communities, Latinos and African Americans, and we're very much from day one working with them to sort of improve their health outcomes on a more personal level. And it was one of the reasons I actually chose the school in the first place, because we were very lucky to be put in the situation so that we're not just learning to become physicians, but also learning to become healthcare advocates as well. And I mean, that's my goal. My goal coming into school was to do that anyway. And I'm just thankful that, you know, especially in more recent years, we've moved in a direction where we become more considerate of the afflictions of lower income communities and communities of color throughout, and especially down here. So
do you think, Dino, just for clarification, so are you saying you have received I would say, appropriate and adequate training with respect to the disparities, the glaring disparities that exist when you look at from a healthcare perspective and, quality, healthcare access and efficiency. Do you feel like you're receiving, and the other students, your fellow students, are receiving adequate training when it comes to understanding the disparities that exist in Black and Brown communities? Because I'll give you one point of reference. When we look at cancers and we look at the number of fatalities from cancers, right? Black people have the highest mortality rate, but the lowest incident rate. And the study or I should say the data or the research shows it's again, it's not because of the high incident rates, but it's because oftentimes we present when we're, at the, stage 3, stage 4. And also there's a big concern people aren't actually accessing the healthcare system because they have no healthcare, right? Even with the passage of Obamacare or the Affordable Care Act, we still know there are millions and millions of people who are still not insured. And so it's because I think in order to change systems and institutions, it starts where both of you are. And so it is critically important that you are getting the exposure and the knowledge in order so when you actually graduate and you're treating patients that identify as Black or identify with other communities of color, that you understand some of the social dynamics, right? And some of the disparities that exist. So I always am interested if these higher education institutions are teaching that adequately and focusing on those sorts of things.
So in that aspect, I'll let Naomi speak on her experience. But for me, we are taught to identify what these disparities are, and I feel like in general, a lot of schools do that, right? They sort of show you what's wrong, who is most affected, and what could be done about it. But one thing that's always missing, and I think that's sort of in regards to the discipline itself, is what is our role in this process, and how can we improve this on a greater level? And that involves collaboration across disciplines. It's while physicians do have power to enact change on a personal level within their communities, when it comes to broader infrastructure levels or infrastructure changes, so changes throughout that would affect the community broadly. So improving healthcare literacy and education for local communities and improving access to care in general. That's not just a physician's job, that extends past that. It requires the work of our politicians, our local governments, as well as community advocates, people in the community working with us. And we use our expertise collectively to improve the access to care in general. And that's not something that we're taught explicitly in school personally. We're sort of taught to work with different disciplines within healthcare, but not so much disciplines that are, like law or social work or stuff like that, like in different realms. So, yeah.
So, Nomi, your thoughts?
So from my personal experience, I do see my school kind of taking initiative in terms of incorporating basic education in regard to disparities within the medical institution. And we do practice clinical cases where they try to represent those disparities as well. And then, of course, the students themselves do a lot of work in terms of trying to create seminars and trying to hold events to educate people. I think one of the main problems I see, though, generally is among the medical students and among the medical staff is the people that are willing to listen. I find that most of the time, the people that want to listen and want to attend these sessions tend to be students that already have an interest in addressing the disparities in the medical field and in healthcare, versus a lot of the times, unfortunately, the students that don't have interest in it don't tend to attend these events, or when it is a required event for all students, they necessarily don't give their full attention towards the information that's presented in these events. So that's unfortunately kind of where I see my perspective. And I've had this discussion with other colleagues of mine in my class as well.
Okay. I'm gonna just jump real quick to a comment from one of our viewers, Holly Hernandez. She's asking, which brand did Dino get?
I received Moderna.
So Moderna. Okay. And let me, Miss Veronica Williams. Miss Williams, I'm not sure if the age is right, but anyway, she says her nephew is unsure of the vaccine. He is listening to you right now with me. Can you, on the spot, give a one sentence, that might be difficult, nugget to getting the vaccine? So what's your elevator speech in any of, and I'm going to direct this and then I'm going to go to the rest of you guys, Nomi and Dino, if you want to, what's your elevator speech? One sentence for the reason why your peers should get this vaccine. And remember, he's listening to us.
I don't think I can do one sentence, but I'll try to do as few sentences as I can. So I think we should get the vaccine. So not only just to protect us, but the people around us. And personally, in my family, I have family that have gotten the COVID virus, and the temporary side effects of the vaccine that I have read about and I've personally experienced, I would rather deal with those than deal with the side effects of getting the virus itself, because my family members that have gotten it are still suffering from it. And some of them have gotten the virus almost 6 months ago and are still suffering from side effects.
Dino?
Yeah, I don't know if I can do this in one sentence, but so I wasn't able to hug my mom for about 9 months during this pandemic. Because I go outside, I had to go for work, and then I had to go again for school. And getting a vaccine meant that I could do that again, just sort of hold her. And that was my reason for getting it, for having that security and knowing that I could talk to her and be in the same room with her without giving her COVID. That was the one argument I needed to get the vaccine for myself. So
Okay, good. So Onesimus, your thoughts on all things vaccine, and what are you hearing? What's the word on the street in terms of your peers, and how are you feeling?
Yeah, so that's it's interesting because I'm hearing, the medical students speak, and the word on the street is that we don't really trust the vaccine. We say that the vaccine had came too quickly. They say, the vaccine came too quickly. How is it possible for them to even come with a solution this fast? And so they're skeptical about it. And like Javon Fields, he mentioned in the past stream was like, it's almost like you guys can test it, like y'all can be the guinea pigs and then we'll try it out. I mean, that's just the word on the street, you know what I'm saying? For me, myself, I wouldn't mind taking the vaccine, but I think still I'm a little skeptical on those side effects. But thank you guys for sharing your side effects and your story on the vaccine as well, because I didn't really know about that as well. So that's my thoughts.
Thank you, Oness. So Carl, you're kind of in a unique position as well. So you're in this retail space, and we know many people are itching to get out, right? And it's been very difficult in terms of when you think of social isolation and just, people who are used to being social on a multitude of levels. And you are actually in this retail space where many people, their therapy is retail. And so you're interfacing with many, many, many people of all races, ages, colors. And so speak a little bit about, kind of what you're hearing. Has anything lifted up with respect to you servicing your customers or your employees? Are there any concerns or fears? And since you are a major retailer, has there been any talk within your respective organization of requiring employees to be vaccinated?
Yeah, absolutely. That's the one thing about retail is you do see all faces of the world. So you have people from all over come into the store with different viewpoints, right? I'll say the one thing I do get a lot of people. So we require to even come into our store. We do provide hand sanitizer and do temperature checks at the door. There are customers who appreciate that we do that, and there are customers that simply don't, and for the reason of this, the idea that we alluded to it earlier is we don't know much about the COVID vaccine and the virus itself. So what I'll say, what I'm hearing a lot of throughout the store is the idea that we have this vaccine that's come out maybe a little bit too quickly, and how is this possible, and how would this affect me, seeing that as I'm not someone that has seen these symptoms firsthand. I'll say I've had a family member who did have COVID, and he shared a little bit about his experiences and being fatigued and not being able to just be active that long, and obviously being in isolation. So the interesting thing is that you do have in a retail space people that do come out and having so many different viewpoints. Is you have to be careful for the people that you see around, being that it's 2021 and I still have people come into the store that question, why do I need to wear a mask? That's it's mind-boggling to say the least, that some of these ideas aren't reaching all platforms. So obviously we can educate the best as possible, but that's not what we're there to do. Now my company hasn't said anything on requiring us to take the vaccine, nor has it even mentioned that. And I think for the namesake of not having, or for not being on one side or the other, to appease all members of the public.
Okay. Mr. Collin, what are your thoughts, and what are you hearing? What's the word on the street?
So I mean, I can speak for Grand Valley community in general, but in essence of what I've honestly been hearing in reference to the COVID vaccine, is a lot of distrust that's going on. And I say that because people are uncertain, whether it be the timeline when the vaccine came out. People are uncertain of the response to what happens if you do take the vaccine. I feel like that frightens people, because when there's uncertainty, it kind of brings that room for people to kind of think drama in, becomes dramatized, and then eventually just carries through that disconnect between Black communities and healthcare, and their trust for those healthcare professionals kind of worsens. So I guess what I'm hearing is that the people aren't taking vaccines, people aren't getting tested, because the idea is COVID doesn't exist. COVID is just kind of this hoax that falls the political guidelines, and scientifically that's been disproven. And unfortunately, it's really the climate that's being read. But it's upon people who are attending these kind of town halls, who are partaking on these panels, to address that and kind of bring that to the forefront, how critical it is to take this seriously.
Okay, so So you're saying, what I hear you saying is that there is a lot of mistrust still. So let me, any of you could answer this, and then I want to jump to Javon. Do you think that will eventually go away or become less of an issue as we continue to move through this? You know, we're literally just in March, so we haven't really fully finished the first quarter of 2021, and I know the Biden administration has said, originally I believe they were saying July. They were anticipating that every American would be vaccinated, but now it seems like that has been sped up, and so they're saying May, and that every American would be vaccinated. So as we are moving through this, do you think that level of mistrust will wane at some point as we go through this? And I'm specifically again talking about when you look at youth and young adults, and anyone can answer that.
Well, I'll answer. I'll say from what I'm used to, and I don't know if you guys are familiar with Simon Sinek, but he kind of dives into human behavior, and a lot of people, there are certain groups that try it out first, and the majority of the population waits to see what happens first before they jump in and do that. So same thing, new technology or something of that nature. A new iPhone comes out, a lot of people wait to get the new iPhone so the bugs can get fixed and things of that nature. And the same thing might be with this vaccine.
Yeah, so kind of a wait and see. Let some other folks jump over the bridge first, and then we'll see how they land, and then we'll make a decision. Anybody else? So President Fields, what are your thoughts? I know you were on last week and made some great comments. Any other information or word on the street that you're hearing?
Yeah, I'm gonna echo what Colin was saying earlier about the mistrust about the vaccines. I had more conversations with young people about their feeling about the vaccine, and like Colin was saying, it came out too fast, right? And then kind of what Carl was saying, that a lot of people want to see how other people go through it, and see what's happened with them, then I'll take it. It's kind of like how when the PS5 came out, we all didn't buy it. Well, a lot of people bought it. Some of us kind of laid back and wanted to see if it'll catch on fire or something first. You know what I'm saying? And so we're trying to see what's going on before we take it. I had a conversation with one young lady. She actually had COVID-19, right? And she was able to recover. She was blessed to recover and very thankful that she recovered, right? But even though she had a COVID-19 and all the symptoms and everything, she still didn't trust taking the vaccine because her thought process was like, even though I had COVID, if I get this vaccine, it might cause long-term effects that might be greater than the vaccine or COVID-19 symptoms, right? And so just trying to make sure that we don't see any long-term negative effects, if that makes sense.
Mm-hmm. How old is she, Javon?
20.
20. Okay. And did she discuss how she contracted this COVID virus?
Well, she didn't say, but I know why. She was out hanging out and everything without using the proper COVID-19 protocols,
Right.
So, and like I said last week too, a lot of people are having COVID symptoms and not telling anybody, and then a lot of young people, for some reason, even I thought like this for some reason, because I know you, I'm thinking you don't got COVID, right? But the reality is COVID don't care who you know. It can attack anybody.
Yeah, that's my concern, quite honestly. I think that those folks, individuals who have some level of hesitancy, right? I get it. I fully get it. When you look at historical situations that have occurred, you look at disparities, glaring disparities that are not even historical, but that are present today that we're still dealing with. However, I think that those individuals who have some sense of hesitancy, but that are not taking the necessary precautions, and that are not, and what I mean by precautions is that they're not conscious of their environment, and what I mean by environment, I mean being in crowded spaces, right? Being up close and personal in their friend spaces, not wearing masks when they are in an enclosed structure or room. Again, not being diligent, because we know it happens, unfortunately, about washing their hands, not being diligent about, when you sneeze, being respectful and covering your mouth and carrying some tissue when you do that, and then sanitizing your hands, right? And so I would say that for those individuals who are doing a lot of movement still, I would strongly encourage you to get vaccinated, quite honestly. I don't care what age you are, because if you are not taking the necessary precautions to not only protect yourself and others, then you are a prime candidate for vaccination, quite honestly. I'm being totally transparent and honest. And how I roll, like, especially Javon and Onesimus, I just keep it 100. And so if you're not doing that, if you're one of those individuals who want to frolic across the entire United States and do whatever you want to do, then you probably are a prime candidate to get vaccinated. That's just my personal belief. And if you're not taking the necessary precaution, and there's been a word on the street about, at some point it would be required, so we're not going to have a choice to take it or not take it, and that choice will come, and it will come down to the basics. If you want to go into a public concert, if you want to go into a public venue, if you want to go into any public space, you will be required at some point to show your vaccination card. Because in Dino, I haven't gotten vaccinated either. And Nomi, I believe when you get vaccinated, aren't they giving you a vaccination card? Okay.
Yes,
So
sir.
again, go ahead, Nomi.
No, I was just answering your question.
So they have given you a vaccination card.
Yes, sir.
So it's like a driver's license, basically. And so there's real concern about whether or not everyone eventually will be mandated to get this vaccination.
President Jackson, I do want to add this real quick, if I may.
Sure.
I had a conversation with my grandmother yesterday. She took both shots, the Moderna and the Pfizer, right? And so she said the doctors told her that, she has a low risk of catching COVID, right? But she said the doctors also told her that she could potentially be a risk for people who didn't take the vaccine, right? When she's breathing and talking without a mask, and someone who didn't get the vaccine could be at risk, even though the vaccine is fighting off the COVID for her. It could potentially spread to me or whoever else she's with, right? And so I had this thought about this. Last 2 weeks ago, I had a job interview. When I walked into the building, everyone that was working in the building didn't have a mask on, right? They didn't have a mask on. And then I asked the guy interviewing me, I said, why isn't people wearing a mask? He said, well, we're all vaccinated, right? And so I just kind of let it go over my head, kept my mask on, stay protected, 6 feet apart, can I get the vaccine? But when my grandma said what she said, it made me think, will it come to a point where I have to take the vaccine? Because if people are getting comfortable not wearing a mask because they're not wearing a vaccine, or not, if people are getting comfortable not wearing a mask because they got the vaccine, but now I'm at risk of catching it more since they're vaccinated, what should I do?
Yeah, that's a good point, and I want to lift this up and remind people, as I think I say this on every segment of the live streams, is that people, we have to understand that the vaccine is not a cure. Again, the vaccines are not a cure. They're just what we call in the medical industry a preventative measure, and that preventative measure is to reduce death and to reduce the severity of the virus if you contract the virus. So it's not a cure. Is simply a preventative measure, and I think that it is a falsehood when people actually say, just like this gentleman said to you, well, we're not wearing a mask because we have all been vaccinated. And it's that level of irresponsibility is just shameful, quite honestly. And I would challenge him, because I don't think everybody in his facility has been vaccinated. Because here's the deal, because first of all, the vaccinations, when you look at the rollout, and there are tiers, tier 1A, B, C, and it's based on frontline workers. They started out with folks who were 65 and older. And just this past week, when the Johnson & Johnson vaccination came out, and it just wasn't because of the Johnson & Johnson. I think there were a number of people who were signing up for the vaccine, and then there were a number of slots who were not being filled. And there were a number of people who did not meet that criteria of being 65 and older. And so right now, so they've moved it to 50 years and older, but you have to have a quote unquote underlying condition, or you have to be quote unquote high risk. And so any individuals that don't fall in that category would not have been vaccinated. Now but the caveat is this, because we know what people will do, and people will lie, people will finagle, and we know, we've heard those stories where people who are not falling into those categories are actually getting vaccinated. And so I'm not sure what the actual check is on that, but I'm almost certain that there are people who are not in the tier 1 group at this point that have gotten vaccinated. And one of the things, and I want to ask you if you've heard this, because one of my colleagues was mentioning this to me. Actually, a couple of my colleagues, one mentioned this to me today and last week when we were talking about the vaccine clinic that we were doing in Ben Harbor in partnership with Meyer and Blue Cross Blue Shield of Michigan. And he lives in the DC, Maryland area, him and his family. And he had sent me a text saying that me and my wife had received our first vaccination. And we went to Baltimore, and I'll just say what he said. He said, we were in the heart of the hood. Okay. So many of you know the series, the docu-series called The Wire, which was like in South Baltimore. That's where they were getting the vaccination. But the interesting thing that he said to me, he said, Clee, it's only 6 people of color in this line getting the vaccination. He says, everybody is white. And so now, if you're holding a vaccine clinic in the heart of the hood, and you got, again, I believe everybody who wants to get vaccinated should have the opportunity. But I also am a believer that allow the folks that that need it the most to get vaccinated, right? And so that has been a huge concern that our white brothers and sisters are essentially bogarting the hood to make sure they get vaccinated. And I would almost say probably some folks don't even meet the criteria, but somehow they're making a way to get vaccinated. And I think a part of that is because there are certain people, and it doesn't matter whether you black, white, green, blue, or yellow, that they're so bent on wanting to get out to a restaurant and to socialize that they're going to find a way to make it happen. So are you all, any of you hearing any of that whisper?
So if I can comment on that really quickly, it's why I was very excited to join this talk today. Over the last year, we've seen that time and time again, the people that are most affected by this virus are Black and brown communities, time and time again. And now we've come to a point where this is vaccine available that could really help everyone. And the people that are least likely to actually get it nowadays are Black and brown communities. The same communities are most affected by this pandemic right now, that are getting the least amount of help. So what's happening, like you mentioned in Baltimore, is just a representation of that's happening throughout the country, where it's this distrust about the process and how quickly this vaccine was made that's preventing a lot of our people from going out there and getting it when it's known to be beneficial, And I want us to address some of these concerns. So when people complain that it might have been put out too quickly, the implication always is that they skipped some steps to make it when they didn't. If you're familiar at all with the vaccine making process, or if you want to make yourself familiar with it, I'll tell you about it now. Every step in the vaccination production process was followed for all three of these vaccines. They have to be, that's the law. And regardless of whatever drug you make in the United States, they follow the same protocol for making it. And it gets approved by dozens and dozens of different teams and people until we get the vaccine that we have today. So while yes, it was produced in 1 year, right? It was produced following every single step of the way, given as much money and resources to make it happen in 1 year. And that's the difference between these COVID vaccines that we have versus everything that we've been dealing with for the last, 20, 30 years. So in general, why you see vaccines being done in 5 to 10 years is in 1 year, because we put all of our resources into getting this done in 1 year. And that was the benefit of it, right? So we tell people, that it was done too quickly. It was done too quickly. It was done very quickly, but it was done well. It was done as expected. And that's the most important thing. And one thing that's been mentioned again tonight is that it's about transmission of the virus, even though you had a vaccine. The most important aspect of this vaccine is the fact that it protects you from getting COVID. And that's the one true thing that everybody knows about the vaccine, is that once you get this dose or both doses, depending on the vaccine you get, you will be protected from COVID. And that's why they made it so that the most vulnerable members of our population are getting it first, because they are most likely to get the worst effects of it, right? And then the younger people moving down, right? Because they get it first before everybody else, because they are most vulnerable to the effects of some of our younger members going out and going partying or going out on the street without a mask on, and then going home later to see their grandma. It shouldn't work that way. And that's why they're getting it first. So when you're talking to other people about whether you're getting it or not, just remember that you're getting it for your own protection, not necessarily to prevent the spread, but to make sure that you come out of this okay, right? That you come out of this well and you can live on the next couple of years without having some well-by side effects from it. Because even now it's been a year and we still don't understand how severe these side effects can be and how long they'll last. And that's something we'll be learning throughout the years. But this vaccine gives us the opportunity, or at least opportunities for people who take it, to live with the anxiety of fear of having to deal with it for the foreseeable future. I apologize.
Yeah, I want to comment on that, Dino, and want to push back just a little. So I want to make sure, because in terms of my research and what I know so far, there's been a lot of conversation around whether or not this the vaccine, in any of the vaccines, would make you immune from actually contracting the virus, right? So the last thing that I've heard from the Fauci team and Biden has his whole medical advisory team and CDC is that the jury's still out on that. It hasn't been confirmed unless something has changed within the last week and a half. But just want to make sure that we, put that out there, because I'm not sure if that's been confirmed, and that's a good conversation. I'll check and see, and you can check if you have some information. You can send me some information offline. You can connect with Kareem and get him some of that information. But I haven't heard of a 100% confirmation of that to this point, unless you know something that's different.
I mean, if I want to add one more thing, is that there's also a misconception of what the vaccine is. So in general, when you talk about being sick or getting sick from something, it's because there is we'll call it a bug, right? There's a bug on a counter, on the floor, in the air, it's floating around, and you catch it. Without a vaccine, without drugs, your body's already built to sort of fight this bug that's supposed to make you sick. Like, your body's built for it already. In some cases, the bug's a lot stronger than your body's ready for, and you end up getting really sick or even dying because of it. What the vaccine does is it helps the person who gets it have a better chance against fighting it. It helps you get the tools you need to fight off this infection, this bug, right, and come out of it, better than before. That's the point of it. So yes, I mean, there's still the jury's still not out on whether you'll still get the virus. But the role of the vaccine itself is to predispose you to do better in the event that you get sick. That's the entire point of it. And that's why we're supposed to get it now, so that in the event that we get infected, we have a fighting chance towards clearing that bug out of our system and staying healthy.
Absolutely. So it's preventative, which makes sense, because it's, just like the flu shot, just like the pneumonia shot, and other vaccines that we've received. It does the same thing. It lessens the symptoms, and especially if, again, you have some underlying conditions. And I would say this, because I think we have to understand too that when we think of underlying conditions, we think that there's been a diagnosis of diabetes, of obesity, or hypertension, of heart disease, or cancers, or some other disease status. But we oftentimes don't think that. I believe the majority of us who are Black and brown are high risk because of social traumas, right? And the stress that has been put on our bodies. And so that in itself presents a problem when something this severe attacks our bodies. So I just want to remind people of that. And then I want to get to some of the questions. We got several questions in the
If I could say something too
in the comments. Go ahead, Onesimus.
Yeah. So I mean, at the end of the day, let's talk about the real reason. You know what I'm saying? At the end of the day, there's always going to be that mistrust about it. I think in due time, sure, but there's still going to be that mistrust of the vaccine. And let's talk about why. I mean, you have the Tuskegee Project. You know what I'm saying? Many other projects that mimic that. And so there's a major distrust in the Black community because of these things. You know what I'm saying? In your example, Cleve, he was in literally the heart of the hood, and only 6 Black people showed up. You know what I'm saying? So like, why? Obviously, so one, I think, we said before, we letting other people try it out. You know what I'm saying? And see how it is. 2, I think we also got to educate ourselves. You know what I'm saying? Let's talk to the Dinos. Let's talk to the Collins. Let's talk to the Wemmys and stuff like that to really understand what we're going through or what the vaccine is. So that's my take as well.
Yeah, that's an excellent point. Let me read this to you all. This was a report that the CDC put out, which I think is very interesting. I want to get your reaction to it because I don't know. One of you mentioned, this perceived maybe, and I'm just paraphrasing, immunity when it comes to youth and young people. And when this first hit the scene back in March of 2020, there was a lot of chatter, a lot of talk about, it doesn't really affect young people and youth and young adults. And so we found that that was actually not factual. Um, and I also think that when it came to reporting the number of positive cases and deaths in youth and young adults, that wasn't real transparent either. So I'm going to read through this real quick. It was something that I got from a colleague today, and about racial disparities among young COVID positive Americans. And this is a CDC study, right? And it says, so those disparities were substantial last spring. Racial and ethnic differences among young people infected with COVID-19 in the US were substantial early in the pandemic, according to the new study from the Centers for Disease Control and Prevention. The Federal Health Agency studied more than 689,000 COVID-19 cases among people younger than 25 years old that were reported to the CDC's case-based surveillance system in 15 states and Washington, D.C. Researchers found that from January through April, in fact, infections were substantially higher among most racial and ethnic minority groups compared with non-Hispanic white people. White people reported just 25 cases per 100,000, while American Indian and Alaskan Native people reported the most of any group at 163 cases per 100,000. Hispanic and Latino people reported 137 cases per 100,000. Black people reported 87 cases. Asian people reported 54 cases. And Native Hawaiian and Pacific Islander people reported 88 cases per 100,000, according to the study, the CDC study. Those disparities declined throughout the year, but that's because there was a greater increase in incident among white persons rather than a decline among racial and ethnic minority groups, is what the researcher wrote. That's just a recent CDC study that was published. So again, it goes to the fact that I think there was an underreporting or spotlight in terms of the number of youth and young people that were a part of the positivity rate, and then the mortality rate as well. So your response to that, Colin, are you still in the studio with us? He might have got kicked off. If not, Carl, your response to that, you have a reaction to that? Is that surprising, I should say, to you?
I don't think it's surprising to me, the disparity that it is. And I think the biggest thing that I take away from that is the fact that, that even though as time went on, that disparity decreased, it wasn't for the lack of the number of cases in colored people that went down, but finally reporting of peoples without color. So that just shows some of the exposures that we have, whether that be in the environments that we're in, obviously some of the neighborhoods that we are, and how close that is to other plants and things of that nature. But obviously, it doesn't surprise me at all to hear that.
Mm-hmm. Mm-hmm. Anyone else? Javon, your thoughts? Reactions?
Yeah, I'm not surprised by what the researcher wrote. I mentioned this last week during the discussion, how when it comes to youth, African American youth, we're not being in the spotlight. So a lot of us assume that, we're not getting this, so we probably shouldn't be worrying about it, right? And then the reality is we are getting it. It's just not being put out there. The thing is, too, is that I was going to mention earlier is that I think you mentioned in the article that between January and March or April, right, when this research was done, there's a high number of youth. And a lot of times that comes from us traveling, so we would go on spring break traveling. I mean, I even have friends this past week went to Miami, right? And they told me how they went to Miami. And how Florida, the restrictions are lifted. So people are walking around with no mask on and not worrying if you were vaccinated or not. So just walking around the beach, going to clubs, things like that, not wearing a mask, just chilling, right? And then come back to Michigan, right? Still not vaccinated.
And they're super spreaders.
Right. I even got people I know going to Miami this week, next week, all throughout March because spring break. And because Florida lifted the restrictions, they think they're good, But then if that report was out there in our face, here's what's going on, especially in this time frame when we're traveling, we wouldn't travel.
So Dino, I see your reaction to that. So brother, are you out there maskless in Florida and frolicking?
I know. I wouldn't say any of that. I'm not allowed. I would like to apologize from Miami. I'm sorry we're such an enticing place to come to. I guess it's just the weather at least. But yeah, I mean, if you walk around, like I haven't been to South Beach in over a year probably, but it's a whole different place compared to the rest of like the county or at least the city. Yes, the restrictions have been lifted across the state, but people are just taking that as an opportunity to just do what they want, especially towards like downtown. And obviously, the people that are most affected or people that are there most often are young people. And nowadays, with spring break, it's going to get even worse. So, I mean, I'm not surprised at all by this report. I just wish that there was a way to communicate this better to our community so they'd be more cognizant of these facts.
Yeah, and I mean we get it, right? People, I mean, quite honestly, this has, taken a toll on all of us on a variety of different levels. And so we get it. But I think that we have to be vigilant, because if we are vigilant in doing what we need to do, it lessens the time, in my opinion, that we have to be stuck. We have to get through this. And unfortunately, just like anything, you have to have some level of discipline in order to get through it. I mean, hell, I want to get out too. I want to see family members and friends and socialize and feel comfortable sitting in a restaurant. And, when we were out, I haven't been in a restaurant since last year. I haven't been in, any public space like that. And it was, it's just taking a toll on all of us. But the sacrifice is, in my mind, is I don't want to be contributing to the mess, right? I don't want to be a contributor, a willing contributor. And so I just can only personally do what I need to do and encourage other folks in my space to do what they need to do in order for us to get through this as quickly as possible. Because it's one thing in terms of getting the virus, that's one thing, right? But it's a whole nother issue in terms of the mental trauma, in the physical trauma that this is causing on many of us. And so we just have to do what we have to do to beat this. We have to beat this. And I think if we're vigilant, and that's why I think it's important to lift up this youth and young adult voice in this conversation, so we understand when these, leaders, quote unquote, leaders and powers to be are making decisions, that they understand, they have a full scope of understanding in terms of how they need to approach these things. I'm going to get to a couple of the questions here in the comments, and also, I guess, just some comments. So Ms. Williams, Veronica Williams says, good evening to some of our local world changers. And So we already addressed the issue with the brand that Dino got. This is from Ms. Stephanie Bell. To the medical students, will the vaccine need to be administered every year? Are you hearing any of those types of conversations? So I think that's coming from, we had our first live stream when we had Dr. Grifka, who's the Chief Medical Officer of Metro Health, University of Michigan here, which is one of the hospital systems. And he talked about the efficacy and also the length of protection, or, and I believe at that point he said, what the research says is at least 9 months of protection, but they weren't really sure if it would go further than that. So I think that ties into Stephanie Bell's question in terms of, and that's been a lot of folks have been asking that, is this going to be an annual vaccine like the flu shot? Now I know when you look at the pneumococcal or the pneumonia vaccine, I want to say that's either, and you guys might know this better than I do, 10, 50, it's either 10, 15, or 25 years. It's something like that. And then but with the pneumonia vaccine, I believe it's it might be 3 shots. But it's a series of shots. But once you are vaccinated, then you don't have to go back. I want to say it's at least 10 years. I know you don't have to go back. I guess that's the question. Are you hearing anything with respect to this being an annual vaccine? Anybody can answer that.
So I can speak a little bit on that. So from the statements I've seen put out in terms of from official organizations on how long they predict the vaccine to work for, like, 1 single dose, or like the 2 doses that a lot of people are getting this year. Like it was mentioned, it's still not necessarily sure. They're still trying to see how long the effects are lasting for, but the prediction is somewhere around close to 9-10 months, maybe a year. The thing with vaccines is that different vaccines attack different, or are meant for different viruses.
Mhm.
And so each virus is different. So from the discussions I've had with a lot of my professors, and from the research I've done myself as well, the COVID vaccine is similar probably to what most people are aware of. From the viruses that most people are aware of, COVID is probably more similar to the flu, in which that it can change its appearance to trick the body and infect you. So people are predicting that the COVID vaccine might be something that you will have to get regularly, like the flu vaccine. In terms of how often you would have to get that, I think they're still doing their research.
Okay, yeah, and I also think it speaks to, we know there are a number of we already know strands, variants, from one being from the UK, South Africa, and there's another strand as well. But anyway, so there's conversation around, again, that was, again, will this be annual? Are the current vaccines effective? And, one of Dr. Shauna Stoddard, who was on here, one of the live streams, she's a biochemist at Rose College, and actually has a lab that she's doing work on a number of antiretrovirals. And she was saying that there could be an opportunity, or there could be a necessity or a need to do a booster, where you have to do a booster to this vaccine. So I think that is still out, honestly. I think we don't know yet. I think it's something it's ever changing, and that's the nature of viruses, because that's the trickiness of viruses. If you know anything about viruses, they mutate, they change, and very quickly. And so that's the difficulty. addressing these things. The other question is, Stephanie Bell says, I agree with the word on the street, brother, out way too fast. the vaccines, and I will say this, you know, as to add some additional information. So when you look at COVID, COVID is considered a SARS vaccine, which which surfaced, I believe, in about 2002 in China, and so it's a SARS vaccine. So there's been a I believe a wealth of research study that has been put into these types of viruses, and so it's it's nothing new. So it's been research, right? I think the difference with this is that because it was a international pandemic, and so many people were dying, just like I think my brother Dino said it, they put all of their resources into this because, this was, you saw we're over 500,000 people now. And so I think they put all of their resources into, developing, because it totally shut down the world, economically, socially, and everything else. And so I think we have to understand that. However, it still doesn't, minimize the level of cautiousness that any layperson would have, rightfully so, because we do know that I think with any drug regimen, when they first get FDA approved, it's a lab is a lab. Right, you got there were over 40,000 people who participated in the trials and all of this stuff. That's all great and wonderful, but there are 300 million people in the U.S. So we know that we are human, and mistakes are made, and sometimes those mistakes are known until you test the product, And so then you have to go back to the drawing board in order to make those things better and better and better. That's why we have what's called recalls on cars and other products, because mistakes were made. And so I'll just leave that right there. Teresa Randleman, T. Rose says, that's right, Javon. She responded to a comment. Ms. Veronica Williams said, do either of you think churches should have in-person worship services? And anybody could address that or take that one.
I will say I've been cool watching church through live stream. Every Sunday, my church, Brown Hutchinson Ministries, shout out to Brown Hutchinson Ministries. They host church through Facebook Live, and I tune in. I don't mind sitting at home watching church virtually.
BH in the house. BH in the house. Shout out to Tabernacle Community, my church, and Pilgrim Rest Baptist Church, and I do the same thing. But it's been interesting because I was talking to a friend, and she was saying that these local pastors are really going to have to step their game up when they come back into in-person services, because now we can go anywhere across the state or across the country and across the world to just see some really dynamic teachers, right? When it comes to faith. And I was telling her, even before everything was shut down, my guy, my main man, Bishop Barber, out of North Carolina, he's one of the coldest brothers in terms of the faith community out there, and it's amazing. Been able to watch him, and I think about Father Flazier over in Chicago with Saint Sabina, and being able to tap into the Saint Sabina online has been absolutely phenomenal. And I think about my brother Dewey Smith out of the Atlanta area, which is phenomenal. So she was saying that some of these folks local members may not be going back to their congregation because everything's online. So, any other thoughts? Anyone else? Should folks be so churches should be having in-person services?
I mean, for me, I think people just miss fellowship, honestly, especially when it comes to church. You can watch online services, but you know what I'm saying, you just miss that human interaction. You can't ask the pastor questions afterwards, or you know what I'm saying, just things like that. But as long as churches follow like the 6 feet rule, clean, I mean, yeah, I think they should have worship services. Why not? Because restaurants are already opened up and anything like that. So
yeah, I think it's preference, right? I think I agree. I think that definitely it's nothing like having that in person. But I tell you, brother, for me to be able to sit at home on a Sunday morning and have me some coffee and some good breakfast and listen to some side music and then listen to some worship or whatever, that's heaven for me. That's all I need. I can always text, and I'm maybe a little unique. I can always text Pastor Artie Gazumbo and what's up, what's going on, and anytime.
You don't miss dressing up, man, for church. You don't miss putting on the suit and tie, man.
Bro, I haven't dressed up for church in the last probably, oh my gosh, I've been going to Tabernacle probably for, I don't know, anyway, 10 years or a little less. And it's very casual. We wear, in the summer, sandals and shorts and t-shirts.
I said, come as you are. So, hey, man, come in a wife beater. It don't matter. You know?
And then on a Sunday, you put your jeans or your Timbs or your gym shoes on, and you come and rock it out, and we're in there for an hour, and we are done.
Yeah, I will say, and Onesimus, if church was open, the usher is gonna make sure that you 6 feet apart.
Okay, yo, the church's bodyguard, the ushers, yes.
Dave's not playing. Make sure you have hand sanitizer too
on deck.
Yeah,
not playing.
Yeah, I got a comment from a viewer that says, "Hallelujah, God is omnipresent." So the other question from Dorothy Sui, she says, "I have a son who had COVID-19, and it has been more than 6 months, and he is still not the same. Can the two medical students help us understand how long it will take for such a person to heal 100%? Nomi, you want to take that and Dino?
Yeah, so I'll be real. From what a lot of the studies have shown, it shows that most people, especially young people, should heal or recover within a few weeks to a few months, right? But in the clinics, I've seen a lot of people coming in with shortness of breath, and things like that, loss of smell, hair loss, 6 months, 8 months, a year after they've gotten COVID. And so, I'll say that for a lot of us in the medical field, or even like a lot of the physicians I'm talking to, we're still trying to figure it out. Even the research itself, we're trying to see if these effects, are they long term or are they not? Because from what we know, what the COVID vaccine does is it can cause some damage to your lungs. And so depending on how your body reacts to it, some of that damage could be permanent damage. And so that could probably lead to maybe you having difficulty breathing from the rest of your life. And so I don't want to give Miss Dorothy here like make her feel like that her son may not recover, false sense of hope or anything like that. But just to be real, that we don't really we still don't know a lot about the long-term effects of COVID, and so that's what a lot of us are just trying to gauge and look into. And I'll pray for your son. I hope he recovers soon.
Thank you, Nomi. Brother Dino, you want to add anything, or?
I mean, just to echo what she already mentioned, it has been a long year. We've made a lot of progress towards, addressing the virus and treating it now. But in a long term, there's still so much that is left to be learned about how it works and sort of why it affects certain people. And like we know broadly that people who are generally older or that have that are immunocompromised, that may have cancer or other underlying conditions, are more readily affected by the virus. We have instances where there's very young patients that have really bad effects, and we don't really understand why. And it's all part of this process. We're learning more about it, and hopefully in the future we'll have answers for why we're seeing certain effects in younger people. For the time being, we're doing what we can with the information that we know, and that's been sort of the motive, not the motive, sort of the message behind getting through this pandemic. Stay as informed as you can, and just sort of, do what you be responsible for yourself as well as for your family, and look out for one another. But I'm honestly, I can't tell you sort of what will happen, in the future with your son or just other patients broadly. But I am also praying for them, and I really do hope for their best.
Yeah, thank you for that. I just got another message, and then we're going to wrap it up because we're a little over time. And I think that's why I love talking to my youth and young adults, brothers and sisters, because they can rock with it and not so uptight, right? And one of the things that I got from another viewer, he just sent me this information. And he says the first human coronavirus isolated at University of Chicago more than 50 years ago. I would say, and I'll say this and then we'll wrap it up. I think that it is important I definitely believe in modern medicine, and I believe that physicians have a role and play a role. I believe that like all of the our specialties that we decide to pursue, they all play a role. It's all a part of the puzzle. I also think that there is a significant part of the puzzle when it comes to holistic medicine. And I think, again, being vigilant and understanding some of the things that we have to do and not necessarily depending on a vaccine or a pill to be the sole source of health and healing. And what I mean by that is that I would encourage folks to do a little research and in terms of holistic therapies, like, something as simple as, taking some additional vitamin D3 daily, making sure that you're getting some additional vitamin C in, making sure you're maybe looking at, the impact of turmeric on your immune system, looking at, meditation and prayer, whatever that looks like for those, for individuals, and just, getting out. And now the weather is changing. I think it's critically important that we get out and get some fresh air. It only takes, the science says 30 minutes of walking a day would do tremendous for your health, right? That's a very small amount for us to invest in ourselves daily. That means simply 15 minutes walking, 15 minutes one way, 15 minutes back the other way, right? Just walking, right? And so just understanding the importance of doing those things, diet and exercise. And I always say that when we look at it from a healthcare perspective, and I'll just talk, especially for my company, I headed up and started this whole initiative called Let's Talk Health. And it was focused on the high mortality rate of cancers among Black people. and brown and other people of color. And one of the things we talked about is the prevention side of it is diet and exercise, right? And so I said, you know, we're not going to ask people to take away anything because that's a turnoff. When you start asking people to not do something, then it's like, but what we encourage people to do is to incorporate more healthier options, right? Incorporate, you know, be committed to incorporating 30 minutes of exercise a day. You got 24 hours in a day. You deserve 30 minutes to yourself, right? And again, if you break it down, walk 15 minutes one day, walk 15 minutes one way, and then walk 15 minutes back. That's 30 minutes daily. That's nothing. Also incorporating more, you know, healthier food options, fresh food, veggies and fruits and different things like that. Again, not take away, but just incorporate. You know, you don't have to eat. Hey, if you eat a whole bag of Oreos, if you're that guy in one sitting with a gallon of, you know, vitamin D milk, if you're that guy, but throw a couple strawberries in that glass of milk and some blueberries, right? You know, put a banana on some of those Oreos, you know, because the reality is this: Superman is not coming to save us. He's not. So we have to do everything within our power to save ourselves. And so with that, so I'm hoping at some point during one of these live streams, we will have some holistic practitioners that will come on and talk and give us some good points to do, because sometimes we think it's so hard and to walk down that road, and it just take a little step at a time. It's it, just a little piece at a time, and that's it. And so I'll end. Does anyone want to say any last comments real quick within 2 seconds?
I did want to make a quick comment about about the distrust that kind of exists of the medical community in a lot of communities of color, and I very heavily acknowledge that. It's the main reason why I chose to volunteer for the vaccine. My parents are in East Detroit. I grew up in East Detroit, and so just to be an example and show people they don't have to be afraid is the reason why I got the vaccine. And the main reason why I chose the Moderna vaccine is because the creator of it is Dr. Kizzmekia Corbett, a Black scientist, a woman of color. So if that helps any bit, that's the main reason why I chose the Moderna vaccine, and I supported it.
Good. I'm glad that you lifted that up and reminded us of that as well. That's critically important. Let me ask this question real quick before anyone, if either you others have just brief closing comments. Valerie Lewis says, does anyone know what what the ingredients are basically in the vaccine, and can it change a person's DNA? So Valerie, I don't know if Dino, if Nomi, if you guys want to speak to that, and that's fine if you don't, because we'll have some other folks on as well that can probably speak to that.
So I've been asked this question multiple times before, and I'm not sure where that comes from, where that idea started. But I always explain it in a way that the vaccine sort of gives you a blueprint towards making like a shield, basically, right? And your body is going to take that blueprint and make the materials needed to protect itself against the virus. So it doesn't change your DNA. It doesn't change who you are as a person. What it does is just it teaches your body how to make the defense mechanism it needs to protect itself. That's it. At the end of the day, you're going to still end up being the same Valerie tomorrow as you were yesterday. Nothing's going to change. It's just a matter of your body being better equipped to protect itself against the virus.
And just kind of echoing Dina, I've also been asked this question multiple times, and I can go over quickly some of the main ingredients in the vaccine. So one of the main ingredients is mRNA, which is the blueprint that Dino is kind of talking about so that your body can recognize it. Another thing is lipids, so fat, and the fat that's in it just helps give the vaccine or the blueprint a greasy coat so that it can help enter your cells. There's salt, just like the salt that all of us are familiar with, and some basic sugar, like table sugar that you put in your coffee, your creamer, or you have with your creamer. So those are the main ingredients that are in the Pfizer vaccine, and a lot of the other vaccines, at least Moderna, I know, share similar ingredients.
Okay, that's good. That's what I was going to say too. And we will, Valerie Lewis will send you. We'll send you one of the resource guides, the vaccine resource guides, which has a ton of information on that. I'll make sure we get that over to you, specifically the ingredients, and we can send that to you as well. And I just want to thank all of you for taking time out of your schedules tonight and being a little patient with us on this live stream. I want to remind our studio audience, or I should say our virtual audience, we do these every Thursday at 6 p.m. and we will continue to do what we call COVID Uncovered, and continue to flood the community with as much information as possible. And if any of you have any specific topics with specifically with COVID or vaccines, shoot those to our email box at info, that's info at naacpgr.com, and then we'll see if we can get experts on and others to address those questions. And before we leave, I want to dedicate this program tonight to our dear friend and sister, Tamara Tammy Dillon, who made her transition on this Tuesday, which was unexpected, as many of you know. And so we will be hosting a memorial service here for her at the NAACP Center for Community Transformation on this Saturday, starting at 3 p.m. And of course, we will be practicing all of the CDC guidelines, but want to encourage the community to come out and support Kaya, her daughter, and the family. And you are welcome to stop by. It is a memorial, so it'll be short, sweet, and simple, and what Tammy would have wanted. Tammy was as a strong NAACP member. She was a volunteer. She also was definitely very passionate about youth and young adults, and did a lot of work with respect to homelessness for youth and housing issues around youth in her work with Grand Rapids Public School System. And so again, the memorial for her will be held this Saturday, 3 p.m. At the NAACP Grand Rapids Center for Community Transformation, which is located at 1530 Madison Avenue Southeast. And if you need any additional information, we will be getting a promotional piece out to community, hopefully by tomorrow, if not this evening. But if you have any questions or you want to make a contribution to the family, you can reach us at info@naacpgr.com. So thank everybody for joining us this evening, and we out of here. All right, bye-bye.
Thank you.
Bye, thank you.